This morning, Tuesday, June 16th, the State Department of Health reported that the number of COVID-19 cases in Miami-Dade County nears 23,000, and 847 people in our county have succumbed to the virus. Now, less than a month ago, we started the phased reopening of our community, and each week since then, we have slowly and cautiously opened up a bit more. At this point, retail and restaurants, hotels and gyms, beaches, and houses of worship are all opened at some level, most with reduced capacities, and all with numerous safety rules and guidelines. So how are we doing, and what should we look for going forward? Because this is a virus that can spread silently and people don't necessarily show a severe reaction immediately, it's important to carefully track data points so that we don't find ourselves reacting too late. Since we began to reopen, we expected some spikes, and there have been some very discernible increases in COVID infections throughout Florida and here in Miami-Dade. In the last 2 weeks, we have seen a few days when the amount of positive cases has been as high as we've seen since we entered the pandemic. Some of it is attributed to the amount of testing we are doing. There are now free testing sites throughout the county and here in our city, and anyone, whether symptomatic or not, can get a test. The result has been many more tests and therefore many more positive results. Now, some of the spikes are also attributed to the inconsistency in reporting by private labs that are doing huge numbers of tests. They often report even weeks of test results all at once. So the chart displays them all on one day, even if the tests were mostly administered on other days. But one fact that can't be explained away is the increases in the percent of positive cases. This lets us know that no matter the volume of tests, there remains plenty of virus in our community. And in many ways, this is the canary in the mine shaft. It is the early signal we need to take notice of. A data point that our healthcare experts also rely on is hospitalizations. While the number of positives can be changed simply by testing more people, or trend lines can be distorted due to inconsistencies in reporting, the need for hospitalization is inviolate. Now, as you can see, the rate of hospitalizations is not decreasing and in fact is slightly increasing. Because of the lag time it takes to be infected and become sick enough to need hospitalization, often weeks, this is a number we need to watch very carefully. So the word has to be caution. Now that so much has been reopened, even if at reduced capacities, we need to be especially careful. The good news is we have tools now that we didn't have when we first started on this journey. For instance, we have hundreds of contact tracers in Miami-Dade County who are investigating every positive case to determine who the infected person has been in contact with so that they can get tested and quarantined if necessary. This allows us to hopefully cabin the spread of the virus. The Department of Health has indicated their tracers are successfully reaching 92% of those infected and tracing back their possible infections. But still, the most effective bulwark against the spread of the virus is our own conduct. Our decisions are the only reason the trajectory of this virus was reversed, and we were able to begin to reopen. So we can't stop those efforts, namely washing hands, exercising physical distancing, and wearing masks. In April, the CDC reversed course and indicated that masks could be helpful in stemming the spread of the virus, and we were one of the first cities in the nation to immediately require them. More and more research seems to confirm the importance of wearing masks. Here's what Dr. Eileen Marty, professor of infectious diseases at FIU, has to say.
We now know, without a shadow of a doubt, study after study has shown that face coverings reduce the transmission of COVID-19 and is one of the effective tools for getting COVID-19 out of a community. And that's what we want. We want to get rid of this virus from our community. So what are the three main types of face coverings? One are the respirators, such as N95s or N99 masks. Those are form-fitted and they have to be fit tested for the person using it. Those are what we use when we aerosolize highly infectious and highly dangerous pathogens such as SARS-2, the virus of COVID-19. Those are mainly for healthcare workers. The second is the medical or surgical masks. Those are 3 layers of non-woven type of materials that are resistant to moisture, and they also should fit very tightly on the face. And those are the kinds that we would like people who are at higher risk for having severe complications from COVID-19 to utilize. People with underlying conditions such as diabetes, high blood pressure, cardiovascular disease, respiratory diseases, cancers, immunosuppressed, people who are elderly, those people should be wearing surgical or medical masks. And last, we have our cloth masks. Cloth masks are for the rest of us when we're out and about. So these cloth masks should have 3 layers as well. This is a perfect example of one. An inner layer, a middle sort of filtration layer, and then your outer layer. A mask like this will provide you some protection, but more importantly, it protects everyone else from you. And it shouldn't have any kind of a valve on it that allows your expired air to go out. So these masks are very effective and we all should wear them when we are out and about. And you know how to put them on. Make sure that your nose is covered and your mouth is covered. This is one way in which we can all protect one another.
The only way to get ahead of a virus that spreads silently is to act before it reveals itself through infections, hospitalizations, and death. As we reopen our economy, it is vital that we are vigilant about these preventative measures. I know masks can be hot or feel odd, but they need to become part of how we interact with one another for the time being, especially when we are inside. And if any city can make masks cool, it is ours. So thanks for your patience and calm, and as always, stay healthy and mostly at home.